Have you ever accidentally nicked yourself while shaving or bumped into a sharp corner? When that happens, a blood clot forms and jumps into action to stop the bleeding. Usually it does its job and then dissolves away, but sometimes things can take a dangerous turn. When blood clots persist, they pose a serious risk, potentially leading to severe medical conditions. They often happen in the legs, especially if you spend a lot of time sitting. However, the symptoms you feel depend on where the clot is. It could be in your arms, legs, lungs, heart, or brain. A blood clot is a clump of blood that changes from liquid to a jelly like or semi solid form. While clotting is essential for stopping bleeding from cuts, it's not so good when a clot forms in a vein and doesn't go away on its own. This can be really dangerous and even life threatening. Luckily, there are signs you can watch out for. If you notice any of these symptoms, it's crucial to see a doctor right away. And remember, all the info in this video is unbiased and fact checked. Remember to hit that like button, subscribe for more health insights, and share to spread the awareness. So let's get into the most common warning signs of blood clots. 7. Swelling. When a blood clot blocks blood flow, it can cause the blood to back up and build up in the affected blood vessel, leading to swelling. If this happens in your lower leg or calf, it could be a sign of a deep vein thrombosis or DVT. This condition arises when a blood clot, known as a thrombus, forms in the deep veins of your body due to injury or slow blood flow. Usually, it's common to have some swelling in your legs, especially towards the end of the day, but you should pay attention to swelling, especially if it persists throughout the day, doesn't subside when elevating your legs, and exceeds the usual severity. It's important to know that blood clots can also form in other parts of your body, like your arms or abdomen. These clots can disrupt the normal flow of blood, causing it to pool behind the clot and leading to swelling. Even though you think swollen legs are just a normal part of sitting for a long time, you should be cautious if the swelling happens quickly and comes with pain. Recognizing these signs early on can help you get the proper treatment quickly. 6. Pain. As a blood clot gets worse, you might start feeling anything from a dull ache to intense pain. The pain can be like a throbbing discomfort in your leg, belly, or arm, kind of like a really bad muscle cramp. If your leg is swollen, remember that lifting it or putting ice on it won't help if it's a blood clot. On the flip side, if these things do reduce the swelling, it's more likely a muscle issue. If you suddenly experience severe chest pain, it could mean that the clot has broken off, leading to lung issues, PE, or causing a heart attack. You might also feel pain in your left arm during a heart attack. Usually the clot will make the area where it is hurt, like your lower leg, stomach, or under your throat. A chest pain that feels heavy, like an elephant sitting on you, could be a sign of a potential heart problem, like a heart attack. This kind of pain might also go to your left jaw or shoulder. If the pain is in the abdomen and worsens after eating or over time, it could be associated with a clot. Describing this pain, experts say it can be intense and sudden, like some of the worst pain a person can feel. 5. Skin color. When a blood clot forms and interrupts the normal blood flow, it can cause noticeable changes in the color of your skin. You might see the skin turning red or getting discolored in the area where the clot is. This happens because the clot throws off the typical blood circulation, causing blood to gather in that spot and giving your skin a reddish or off-color appearance. Now, the area of your leg dealing with swelling or pain from the clot might feel warmer than the rest of your skin. This is your body's way of responding to the clot. It sends more blood flowing to the affected zone as part of its inflammation playbook. And if a clot decides to block up veins in your arms or legs, your limbs might take on a bluish or reddish tint. Even after the clot is gone, that skin color change can stick around because some of the wear and tear on your blood vessels during the clotting action. In a pulmonary embolism, PE, where a clot gets stuck in your lungs, your skin might turn pale, bluish, and feel clammy. The clamminess refers to a cool, moist, and slightly sticky sensation on the skin. It is the result of the body's response to the decreased oxygen supply caused by the clot, which can lead to feelings of discomfort and a sense of coldness on the skin. It is like your body's way of saying, hey, something's not right, as the clot disrupts the pressure in your blood vessels, breaking down red blood cells along the way. These subtle shifts in skin color are like your body's SOS signals for a potential blood clot. Number 4, trouble breathing. This might come with a persistent cough, and in more severe cases, you might even cough up some blood. Alongside this, you could feel chest pain and dizziness. The reason behind this is simple. Blood clots mess with the normal flow of oxygen rich blood to your body's organs. When a clot blocks this flow, your heart has to put in extra effort to pump blood into your lungs so it gets oxygen. The downside is that your heart has less energy for other vital functions, like pumping blood to all parts of your body. This strain on your heart means it might not beat as fast as it should, leading to low blood pressure and that dizzy feeling. Number 3, nausea or vomiting. Nausea and vomiting are common symptoms associated with various conditions, which include viral infections, the flu, and food poisoning. However, it's important to note that blood clots in the veins can also lead to nausea and vomiting by obstructing blood flow through the veins. The risk is especially associated with factors like taking birth control pills or hormone replacement therapy. Typically, blood clots in the veins are not considered acute and may not require treatment unless they become painful or result in swelling in your limbs or abdomen. However, persistent vomiting lasting longer than 24 hours demands medical attention, as it could be indicative of an underlying serious condition. Number 2, diarrhea. Diarrhea often comes with other signs that could indicate deep vein thrombosis, DVT. In DVT, blood clots form and mess up the normal blood flow to organs, including the intestines. This disruption can cause stomach issues like pain, cramps, and changes in bowel habits, such as constipation or diarrhea. Now, diarrhea happens with DVT when blood clots mess with the blood flow. In this case, the intestines might not get enough oxygen. This lack of oxygen can irritate the intestines, making them more active and leading to diarrhea. Also, the clot can damage the local tissues, creating an environment where bacteria can invade and make things worse, contributing to diarrhea. And number 1, high blood pressure. High blood pressure can wreak havoc on your arteries, damaging their walls and paving the way for trouble. When your blood pressure is high, it sets the stage for the formation of plaque deposits that toughen, narrow, or even block your arteries. These deposits, in turn, can trigger the formation of blood clots. These clots are no joke. They can travel through your bloodstream and jam up the works, cutting off blood flow to your heart or brain and potentially causing a heart attack or stroke. High blood pressure doesn't just stop at damaging your arteries, it also messes with your blood vessels, making them narrower and stiffer while encouraging the buildup of fatty material, a process known as atherosclerosis. Blood clots can latch onto these fatty areas, and if one decides to move to your brain, it can result in a stroke or transient ischemic attack, TIA, also known as a mini stroke. Beyond the heart and brain, high blood pressure induced blood clots can affect your kidneys. A clot in the kidneys can disrupt their proper functioning, affecting their ability to function effectively and clear waste from your body. Left untreated, this can lead to kidney failure or heightened blood pressure levels. You might also notice warning signs like difficulty breathing, swelling in your legs, blood in your urine, or even a fever. If you think you might have a blood clot, don't wait around or try to figure it out on your own. You can't always tell if your symptoms are from a clot or something else. That's why it's important to see a doctor and get their expert opinion. Getting treatment quickly is key to dealing with a clot and preventing future ones. Don't forget to give this video a thumbs up and subscribe for more helpful health tips. Sharing this info could make a real difference and even save someone's life.